in there. So just wanted to let you know. So I would like to welcome you all at this point in time to our omega-3 index webinar. I'm here with Jen Patriarca. She is with Standard Process. She's a rep, and she's got all kinds of background in biology and chemistry and all kinds of fun stuff. Anyways, what we're going to do is we're going to talk a little bit about how the omega-3 index is a better indicator for your health than cholesterol. So that's the plan for today. I'm going to just leave it on this way. Whoops, let's get that off. Of course, it gives me this goofy thing. All right.
Can you make it full slide? Like, can you go into presentation?
Yep, sure can. I'll let you do it even if you want to hit these things down. Okay. Go ahead.
Okay, so we're going to just talk about what is your omega-3 index and how it affects your health, how it affects your cardiovascular health, how it affects inflammation and pain, your moods. And we're going to talk about this all in the context of a really easy test that you can do, super affordable. It's easy as a pinprick, just like you would take a glucose test. And it's all available through here at SouthCheck Health and Wellness. So we're just going to take you a little bit through why you would want to know your omega-3 index, why it's important, why it's more important than your cholesterol. Everybody's worried about their cholesterol numbers, but really they should be worried about their omega-3 index. So we'll just talk a little bit more about that. Is it okay if I take these down?
Yeah, absolutely.
So this is what we're looking at, and this looks a little bit complicated, but I just want to break it down and make it super simple for you. So when we're doing this, what's called a blood spot test, which, you know, it's just that we use a lancet like you would for a glucose test. We prick your finger, and then you put the blood on a piece of paper. And then what they're looking at is they're looking at these this outer layer of the red blood cells, and we're looking at the fatty acids. We're looking at how much EPA and DHA are in your red blood cell membrane. So we take the total number of fatty acids in this membrane, and we just divide it by EPA and DHA, and that gives us your omega-3 index. This EPA and DHA is super important for not only the health of the cell, but the functioning of all of your systems, really. It's, you know, this membrane allows for the bad stuff to get out of the cell and the good stuff to get in the cell. So, but it is also important for other things. So that's why we're looking and measuring how much DHA and EPA are in the red blood cell, the outer layer of that red blood cell. And we get EPA and DHA from eating fish. That's one of our main sources. We can't get it from other sources like walnuts and other nuts. We get flax, but we have to convert those oils into EPA and DHA, and it's not very efficient. So the best way to get those oils is really through fish, by eating fish and taking a fish supplement. So we'll talk a little bit more just about like basically what the statistics look like throughout the world. So if you look at, this is a map, a global omega-3 index. If you look down here as your little key, this is your omega-3 fatty acids. So the red is below 4%. So you can see the United States and Canada, Brazil, India. We are below the 4%, which means that's really bad.
Right.
You don't want to be there. 4 to 6% is the orange. So you can see Russia, China, Australia. It's a tiny bit better, but not much. The yellow is 6 to 8%. So along these coastal regions here, outside of Argentina and up here, you can see obviously where people are living. A lot of times on the coast, you'll see where their omega-3 index is a little bit higher. And then the green, which is 8% or above, is where you want to be. And you can see there's very few places, Alaska, Greenland, again, Japan over here, especially the, you know, obviously Japan's, you know, coastal, where they have access to fishing. You can see the omega-3 levels are where they should be. These places that are green have the lowest incidence of heart disease and other risk of other chronic conditions. The gray, as you can see, there's no data set for these countries. So we don't know what the omega-3 index looks like for those countries. But you can see that the majority of the world is below what we consider to be a healthy omega-3 index, and that's 8%. 8% or above, 8 to 12% is where we want to be.
You know, the interesting thing is too, you know, she had said, you can do the next one. She had said that, you know, fish is where you want to get it from. A lot of people don't like fish, and so there are things that we'll talk about as far as fish oils that you can do. But when you do fish, you want to make sure that it's a cold water fish, because that's when you're going to get all your oils at. So
yeah, the deep, that's a really good point. You don't want farm raised if you can avoid the farm raised fish. You want the deep cold water fish, cod, sea bass. Right. You know, those are the salmon. Those are the types of fish that you want to concentrate on. So this is what the research says about the higher levels of omega-3s. And if I'm just going to read through some of these. So healthy men with low omega-3 levels were at the highest risk for experiencing sudden cardiac death than those with higher levels. And I'm going to give you kind of a better indication of what that looks like here in a second. Basically, higher omega-3 index was also associated with a favorable cardiac risk profile. So again, if you have any history of cardiovascular disease, you have a family history, omega-3 is super important, omega-3 index. So it's definitely something you want to be focused on. Women, especially postmenopausal women, as we age, the hippocampus, or the memory center of our brain, is reduced for those women that had lower omega-3 index. So super important for women, especially your menopausal women. They did a study in 2018, and they looked at women of childbearing age, and they wanted to see how many of these women were getting the dietary guidelines for omega-3 index. 100% of those women were below the dietary guidelines of the 250 milligrams of omega-3s of EPA and DHA per day. 100%. So that means, you know, every woman that is childbearing age wasn't getting enough of these omega-3s, which is super important because those pass on a lot of benefits to the fetus and to the baby. Higher EPA and DHA in the red blood cells, or, you know, of course, the omega-3 index is shown to have more favorable outcomes in patients with depression. So there's a strong association between inflammation in the brain and depression. In fact, they're even starting to use some anti-inflammatory drugs to treat depression. So there's a very strong correlation here. If you have a history of, I would say, anxiety, depression, any mood disorder, then your omega-3 index should be something that you should find out.
You know, anytime you have inflammation, whether it be arthritis, gut inflammation, any of that stuff, you need to have a way to reduce it. And fish oil is always great for reducing inflammation. I know I just upped my doses probably about a month ago because my fingers and hands were sore. By doubling up my dose, my fingers and hands haven't been sore anymore.
Yeah, it plays a key role in controlling inflammation. It's the precursor for something called endocannabinoids. Most of you are probably familiar now with all the hemp on the market, right, and CBD. So we make our own endocannabinoids, and in order to make those, we need EPA and DHA. So another reason why they're super important, because those endocannabinoids really control stress, inflammation, support your immune system, among other things. So
speaking of endocannabinoids, interestingly enough, we have those receptors already in our body. So standard process makes a hemp oil that, you know, it automatically, the body is waiting for it to get it, to utilize it so that it can upregulate and help our body to function better.
Yeah, it's just like anything else. You know, when you don't eat a good diet and you're stressed, you don't make as much, or it's not available in your body. As I said, you know, we make our own, but it's not available. So you can supplement with hemp oil, which has endocannabinoids to, again,
not that we were going to talk about that.
No, it's super important. This is a good place to talk about endocannabinoids because, again, the EPA and DHA are super important to make those. So having blood trans fat levels less than 1% is very cardioprotective. So what does that mean? That means trans fats is bad fat. So when you're eating fried foods, french fries, potato chips, You'll see anything that says hydrogenated oil on a label, that's trans fat. So in this test, you'll also look at your trans fat levels.
And also realize that when you're eating foods, just because it says 0 trans fats doesn't mean that there's no trans fats in it, because what they do is if it's like less than, I think it's 0.98%, then they don't have to say that there's a trans fat in there.
Right.
So if there's less than 1%, then they can say, oh, 0 trans fats. So there's little ways that the FDA and these places are allowing people to shove these trans fats in, which are horrible. So really, just another aside, when you take a fish oil, it takes about 17 days for the half-life of that fish oil to be able to be utilized. So half of it's gone in 17 days. When you get a trans fat, it takes 49 days. I'm sorry, it takes 52 days, which is over 7 weeks to get that out of your system. So that causes your brain to have all kinds of malfunction and problems that you really don't want to have. So that's why the high quality EPA, DHA fish oils are so much more important, and make sure that we've got good quality fish oils to help our bodies function higher level.
Right, and we'll talk about the different types of fish oil. Specifically, one of them is cod liver oil. You can see this was a Norwegian study showing that children who took cod liver oil, which is very high in EPA and DHA, the mothers took the EPA and DHA during pregnancy, had higher IQs than those women who did not receive the supplement. So super important, again, for the childbearing age women. Also, women with DHA blood levels below the 5% in early pregnancy who took or supplemented with DHA during the first half, they lowered their risk of early preterm birth by 42%. So that's a pretty significant number.
Absolutely.
And preterm risk by 11%. That's still pretty important. So great, again, super important for the pregnant moms and breastfeeding moms. That's the best time to be taking a fish oil and supplementing, is when you're pregnant and breastfeeding. And then people with the highest omega-3 index levels live longer than those with the lowest levels. So I'll show you, and hopefully I put it in here, there's a study that was done in Japan. Japan, because they have the highest levels of omega-3 index, tend to live 4 or 5 years longer than most everybody else in the world. So this was what's called a meta-analysis, and that means they take a look at a bunch of studies. So this was 10 studies worldwide. They looked at 27,000 subjects or people across the world. And basically what they found was that this was your risk of dying. So your odds or your ratio or risk of dying goes up. And then this is your omega-3 index. So you can see that as the omega index went up, your risk for dying from fatal cardiovascular disease decreased by 37%. So again, any risk of cardiovascular disease, family history of cardiovascular disease, super important to get this omega-3 index up to 8%.
And remember, heart disease is the #1 killer in the United States. It's like 597,000 people die every year. And then if you back down to, I think it's number 6, is stroke, which is like 180,000. So when you put the two of them together, that's a huge number of people that die every year from cardiovascular problems. And if we can do something in order to reduce that risk, we have a lot more people that are going to be living.
Yeah. If the odds say that if you're going to die for something, it's probably going to be heart disease.
Right.
So even if you don't have a risk of cardiovascular disease or family history, this is definitely something to consider.
And it's not always just the death. You also have to remember that a lot of people who have heart attacks or even strokes, it totally changes their lives. Yes. And they're no longer oftentimes functioning members of society anymore.
Right. So everybody's worried about cholesterol. So we wanted to show you this, and it looks a little complicated, but I'm going to break it down for you. So again, if you look at this axis, this is your risk of dying, okay? So as you go up, your risk increases. These are called quintiles. This is your omega-3 index. So this is a 4.2 or below. And then as you come along here, your index goes up, okay? This quintile is cholesterol. So this is below 154 cholesterol, so really low cholesterol, or over 220, 218. So this would be higher cholesterol. Again, this is your risk for death. So as you can see, whether you have low cholesterol or high cholesterol, your risk of death doesn't change. It's the same. Actually, it's a little bit in here where it changes. Where if you look at the omega-3 index, so as your omega-3 index goes up, your risk of death goes down by almost 30%. So again, this was 2,500 people they looked at. Mean age was 66. They were followed for about 7.3 years. So you can see cholesterol, again, does not make a difference. Omega-3 is what we really want to concentrate on. This was just the omega-3 index reflected with consumption of fish and supplementation. So Omega Quant, which is the lab that you'll be using, they survey patients when they're taking blood samples, and they ask them how many times a week do you eat fish and how much do you supplement, or do you supplement? And so these were the statistics. So if you eat no fish per week and you don't supplement, your average omega-3 index is 4.3. So this is just if you want to guess, you know, which we don't want to guess, but you know, these are averages. So if you don't eat fish but you supplement, you could get up to 6.7. Again, eating fish every other week and not supplementing, here's supplementing. So you can see always supplementing with fish oil is going to put you in the best range. You can see these are all the red. So these are people that are eating fish 3 times a week and supplementing. That's where we want to be. We want to be in that 8.3%.
So eat fish.
Eat fish. Definitely eat fish. Cold
Cold
water,
water.
deep sea,
Yeah.
not farm raised.
Exactly.
This was just the study that I mentioned before. So it was postmenopausal women. It was about 1,100 women that participated in the study. They had a blood drawn. Again, they looked at their omega-3 index and they correlated with brain dimensions. So what they found was that there's a positive correlation between omega-3 index and total brain volume and hippocampus volume. So super important. If we don't want our brain to shrink over time, we want to eat a low carb, high nutrient, you know, dense diet with fruits, veggies, and meats, and supplement our diet with, you know, fish, supplementation, and of course eating fish as well. This is what your omega-3 index report will look like. So this was just a sample done. This person happened to be at 6.1%, sorry. Typical range, again, for Japan and for those that have a longer life expectancy, is the 8 to 12%. So this is where we want your range to be, somewhere between 8 and 12. So again, when you do your omega-3 index, this is one of the things that Dr. Septrick will be looking at. And then based on where your range is will depend on how much you'll supplement. So if you're below 4% or below, we're going to do about 1,500 milligrams a day. If you're in the intermediate, so between 4 and 8, we'll do about 750 milligrams. And Dr. Septrick will do that math for you, and he'll calculate which product is best for you. And then if you're in the 8 to 12 range, you're doing great. You don't need to change anything really. We'll also look at your omega-3 to omega-6. This is super important. Not many of us, unfortunately, eat enough omega-3s to balance the omega-6s.
And there's so many omega-6s. I mean, everything, you're getting inundated with omega-6s right now.
Yeah. Omega-6s are your vegetable oils, a lot of in your processed foods, your baked goods. Yeah, safflower, sunflower, canola, peanut, those. We're also going to look at what's called a arachidonic acid to EPA ratio. This is going to tell us where your inflammation is. So hopefully you're within this desirable range. Oops, sorry about that. Got a little click happy there. If you're down here, we're going to add a few other things to help with your inflammation. So again, Dr. Septrick will be looking at this and take this into consideration. And then lastly, as we mentioned, your trans fat index. Again, we want this below, right, less than 1 is ideal. You'll also in your report get a printout of good sources of fish and seafood and how much EPA and DHA that you'd be getting from a serving of these type of things. So just a good resource for you. You can see most of it obviously is going to be from fish and seafood. We don't want you eating the farm stuff. Try to stay away from the farm stuff if you can. Stick with the wild. It's just cleaner and healthier for you. You're also going to get a list of the bad stuff. So where are you getting that trans fats? So margarine is a huge one. You should be staying away from that. Eating real butter, canned biscuits, canned cinnamon rolls. So these are just some of the things that you're going to be trying to stay away from to bring that trans fat index down. So you can order your omega-3 blood spot tests through the office. So if you just call the office or come in when you're in for your adjustment and tell doc that you like to get your omega-3 index done, it's a simple process. They'll actually do it in the office. They'll use this little lancet here, or actually you'll do it. You'll just prick yourself, you'll blot it on this little blood collection spot, and they'll stick it in this envelope, and you'll have your results in 1 to 2 weeks. So it's super simple, and then Dr. Sopcich will go over those results with you, which are the values that I just showed you. And then we just wanted to talk a little bit about the family omega-3. So what are your options as far as supplementing? I would say 95% of us are probably going to need to supplement with fish oil because our omega index isn't where it should be. Right. Even if we're eating fish 3 times a week, as we saw, it doesn't get us to that 8%. So we have to supplement. So we have our maintenance line, which is our cod liver oil, probably one of my favorite oils because it has the A, the D, natural occurring CoQ10, other things. We also have calamari oil, tuna oil, and then we have a kids chewable tuna omega-3 oil. By the way, this is a great test for kids. Right. We should, especially if they have things like ADHD or concentration issues, mood disorders. This is definitely something for kids.
Fish oil is huge for my one son. He's actually in chiropractic college now. Anyways, when he was in 1st grade, he could not read at all. They were trying to teach him something like the cat went up the hill, and he just was like fumbling through it. And when he finally got through it, I'm like, okay, so what did it say? And he started all over. Couldn't figure it out. So what I did was I had him taking fish oil, and I'm like, all right, you can take 20 of these little pills a day, because I really wanted to pound it for him. Within 3 days, he was reading. It was amazing. It was that fast. So the fish oil just enhanced his brain to be able to read better and to understand. And I think that's huge. A lot of times these kids are struggling in school, and we just don't know that the fact is that they're eating all these processed foods and they're not getting any kind of oil, so their brain can't develop. And at a young age, it's like their brain is shrinking. Yeah,
that's important. The kids' diets aren't what they probably should be. They're eating a lot of processed foods. They're pickier eaters. Right. So this chewable tuna oil is an orange flavored.
It's okay.
Yeah.
It's okay.
It's okay. But it's a great way to supplement the kids because the diets, even eating fish, I taught my kids to eat fish at a young age. It's important for the kids. But if you can't, squeeze in some, hopefully non-hydrogenated fish sticks. Right. That's better than nothing. And then if your levels are super low, we do have the higher levels of DHA and EPA in this old Prima line. So we do get our cod liver oil from Norway. It comes straight out. It's some of the cleanest waters in the world. We use 3 different species of cod. Again, we don't add any natural A or D. It just comes that way. Every batch is tested for contaminants. This is a super important product for kids and adults alike. Not only for this EPA and DHA, but for this vitamin A and vitamin D. Super, super important.
Tends to be that most of my patients test for the cod liver oil off of summertime. Like summer, it tends to be more tuna, but the other times when they're not getting as much sun, they tend to test more for cod liver oil.
Yeah. You can also, of course, use the standard process tuna oil. We fish most of our tuna out of the South Pacific, where there's very low contaminants. And again, we test each batch for PCBs and mercuries, peroxides, anthocyanins levels. So we don't alter the balance of the omega-3s in the fish oil. We use it naturally occurring. We believe, of course, nature knows best. And again, this is to help strengthen that cellular membrane with the EPA and DHA. And then remember I talked about, it says it increases cellular permeability. That just means, again, that layer around your blood cell, your red blood cell, has to be fluid. The trans fat can make it very hard, and so that good nutrition can't get out and the bad stuff can't get in.
Just a side note on this tuna oil. I had a patient who worked for the EA group, which is an environmental group in Painesville, actually. And she came in one day and she goes, "I tested your fish oil." I'm like, "What do you mean you tested my fish oil?" She goes, "Well, I ran through some tests." She goes, it's clean. It's really good. There's no mercury, no nothing in it. I'm like, well, I told you I'm not going to sell you garbage. And that's the thing. Here's the thing with fish oils. It's really important to get quality fish oil. You can't just go to Mark's or Sam's or Costco
right.
or you know, these places and get this garbage fish oil that is, you know, a big thing of it or whatever. It's really important. In fact, a lot of the fish oils that you're going to get in places like that have either been deodorized so that you can't smell them,
yep.
or if you break them open, they smell horrible, which means that they're no good for you. Okay, and so a lot of those oils are oils that places like Standard Process go, nope, this doesn't meet our quality. You guys can take it. So you might get cheaper oil somewhere else, but it's worse to eat bad fish oil than it is to eat no fish oil. So it's really important that you're not getting fish oil that's bad. So just wanted to throw that in.
Yeah, quality is super, super important. So again, this is just another one of our fish oils. And again, Doc can test you for which one your body tests for. But again, supporting not only cardiovascular disease, moods, healthy joints. If you have, remember Doc talked about his hands hurting.
I'm actually doing 6 of these a day right now.
Yeah. So memory, brain, if you're postmenopausal women, you should absolutely be doing this. Again, risk of cardiovascular health too, or disease, again, is definitely a must. So 4 a day is the recommended dose. Doc, again, can test you to see which works best for you. If your levels are extremely low, and again, we'll know by looking at your omega-3 index, so they'll be below the 4%, he'll probably recommend something like this, which is the old Prima EPA DHA. This is just a higher dose fish oil, so you have to take less of the pearls.
So this is just kind of a thing we put together, and it's pretty simple how it works. All we do is when you come in, you get the test, you prick your finger, you stick it on the sheet. We end up sending it out. A couple of weeks later, they're going to give us results. When we do get those results, we're going to download them. We're going to call you in. We're going to sit down and we say, okay, here's what's going on. Here's what needs to be done. Here's, you know, are you ready to make a change, or do you want to stay in and keep your index low? And you know, it's up to you. So I'm looking forward to getting mine done. I'm going to be doing mine tonight.
Yeah, so then 3 months later, Doc will put you on the appropriate supplementation based on your results, and then we'll do a follow-up for you in 3 months, showing you, you know, the changes in your omega-3 index and among other things. But you'll be probably feeling better too.
And it's not crazy expensive. It's $49.99. It's not crazy expensive. I mean, where else can you find out how your risk of heart issues are, or your cardiovascular system is, without you know, going to a medical doctor and then spending $200 just to go for your appointment, and then spend another several $100 on blood work that's not going to even give you the same kind of information. So
don't worry about your cholesterol. You want to know what your omega-3 index level is.
And you saw the cholesterol. When it's low and when it's high, it's a problem. So I mean, you know, neither one of them are really good. And a lot of people are like, oh, my cholesterol is great. My doc says, look, you know, my cholesterol is 130. I'm like, dude, that increases your risk of stroke. That increases your risk of liver disease, lung problems, dementia, all kinds of things. So having low cholesterol is not a good thing.
Right. Look at your omega-3 index, though. The more, the better. So higher the omega-3 index, better cardiovascular, decreased risk, and also better neurocognitive health too. We all want better memory, better concentration. So again, this is something that can easily be done in the office. And if you have any questions, feel free to email us or call. Let me just look and see if any of you guys have any questions on here. I can check that out right now. If anybody has a question, feel free to put it in the chat box. Let's see, where's chat box? Otherwise, I guess what we're going to do is we're gonna sign out for now. And again, feel free, if you have any questions, to email them to us. Looks like, is it possible to take too much fish oil? Sure. You know, if you're going to do down a bottle at a time, that's going to be too much, like with anything. But, you know, the question is too much. I know that typically I like to muscle test to find out how much people want, how much their body wants. And like I said, right now I'm taking 6. There's a lot of research out there that talks about 10
10 grams of fish oil and seeing huge changes in people's health and in their brain and all kinds of stuff. Now, you're not going to stay on that for a prolonged period of time, but there's a lot of research out there that shows that high dose of fish oil that makes major changes in people's lives.
Yeah. Yeah, but again, you don't want to do that long term.
Right.
There's no benefit to doing it long term. So, you know, you might want to do it for a short amount of time or get those omega-3 levels to where they should be between the 8 and 12% and then back down. Right. Unless there's been some sort of injury, like, you know, a massive head injury, that's where the 10 grams and even above come into play.
So I want to thank all you guys for coming. I want to thank Jen for being here to go over all this with us, to help you guys to understand a little bit better as to why you would want to take fish oil and why you would want to find out what your omega-3 index is. So if you have any questions, again, our email here is, what is it? It's dr.sopchak@hotmail or concordwellness230@gmail, either one of those. Or feel free to call and leave a message. We'll be happy to get back with you guys. So thanks for coming. Have a great night, and we'll see you soon.